Every single minute during a heart attack, your chance of survival drops. And if you're alone, the clock is merciless. In this video, you'll discover exactly what to do in the first 10 seconds if your chest tightens, your breathing falters, and there's no one around to help. We'll break down the 5 warning signs most people miss, the 8 emergency steps that buy you time until help arrives, and the 3 daily habits that dramatically reduce your risk in the future. Stay with me until the end, because I'll also give you a printable checklist you can keep on your fridge, a simple sheet that may one day save your life or the life of someone you love. I'm Dr. Eli Morgan. For over 35 years, I've guided patients through emergencies where every heartbeat counted, and today, I'm here to make sure you're prepared when it matters most. When most people imagine a heart attack, they picture someone collapsing instantly, clutching their chest like in the movies. But the truth is far more deceptive. Attacks often begin quietly, with small signals that are easy to ignore until it's too late. This matters even more if you live alone. Research from the American Heart Association shows that people who experience a cardiac emergency without immediate support face higher mortality, not because treatment is impossible, but because critical minutes are lost before action begins. That's why you and I are here today. Everything I'll share with you is grounded in evidence from leading medical institutions like Mayo Clinic and the World Health Organization. I've seen firsthand how preparation can flip a story from tragedy to survival. And I want you to have that same power in your hands. Here's the hard reality. When a heart attack strikes, every passing minute can damage heart muscle permanently. Doctors often say, time is muscle. The longer blood flow is blocked, the less heart tissue survives. For people who are alone, the danger isn't just the attack itself, it's the delay. Without quick recognition and decisive steps, many never even reach the hospital in time. But here's the encouraging part. Medical studies confirm that simple, immediate actions like chewing 1 tablet of aspirin and calling emergency services can dramatically reduce the severity of a heart attack. In other words, survival isn't just about luck or access to technology. It's about what you do in the very first moments. And that's exactly what you'll learn today. Not long ago, one of my patients, Mrs. Anika Patel, a 62-year-old retired teacher, woke up at 4 a.m. with a dull ache in her upper chest. She thought it was indigestion, but within minutes, the discomfort spread into her jaw and left arm. Alone at home, she remembered the steps we had practiced in my clinic. She sat down, chewed an aspirin she kept by her bedside, and called emergency services before her symptoms worsened. By the time paramedics arrived, she was still conscious, stable, and able to receive rapid treatment. Those small, immediate actions made the difference between a massive heart attack and a manageable recovery. If hearing Anika's story makes you realize how urgent this knowledge is, then don't keep it to yourself. Subscribe and stay with me, because what we're about to cover could literally save a life. In the next few minutes, I'll walk you through 5 early warning signals your body may send, the 8 exact steps to take if an attack strikes when you're alone, and 3 daily habits proven to lower your risk. And at the end, I'll share a free checklist you can download and keep in your home. Myth bust and preparation. Most people think a heart attack looks like what we see on television, someone suddenly clutching their chest and collapsing without warning. In reality, it's often far less dramatic, and that's what makes it so dangerous. Real heart attacks tend to creep in. The discomfort can begin as mild pressure or heaviness that slowly builds over time. Some people describe it as if they were carrying a heavy backpack on their chest, or like an invisible band tightening around their torso. It doesn't always feel like a sharp pain. Even more confusing, symptoms can appear in places you don't expect. For example, pain can radiate into the back, jaw, or even the stomach. Others may only notice unusual fatigue, dizziness, or nausea. Women and older adults in particular are more likely to experience these less obvious signs, which often get mistaken for simple stress, indigestion, or exhaustion. This is why many people delay seeking help until it's too late. They wait for the classic Hollywood collapse, but the body was warning them all along. Recognizing the reality that heart attacks are often subtle and gradual is the first step in protecting yourself. So before we talk about exactly what to do if you find yourself alone during one, we need to get crystal clear on the warning signals your body might be sending. Once you can recognize them, every decision that follows becomes faster, calmer, and potentially life-saving. The 5 warning signals. Your body almost always tries to warn you before a heart attack becomes life-threatening. The challenge is recognizing those signals in time. Here are 5 of the most important. Signal number 1, chest pressure or tightness. Not always sharp pain. More often, it feels like something heavy is pressing down on your chest, sometimes lasting more than a few minutes, sometimes coming and going. Signal number 2, pain radiating beyond the chest. It can spread into the left arm, both arms, the back, jaw, or even the upper stomach. Many people only notice a dull ache in the neck or teeth and don't connect it to the heart. Signal number 3, sudden shortness of breath. Struggling to breathe while sitting still or getting winded, climbing stairs you usually handle easily can be an early alarm. Signal number 4, unexplained nausea, dizziness, or cold sweats. These can masquerade as stomach flu, food poisoning, or just being run down. But when combined with chest discomfort, they're red flags. Signal number 5, unusual fatigue or weakness. Many women report feeling overwhelmingly tired in the days or hours before an attack, as if they'd run a marathon without training. Men may notice they can't finish simple tasks without needing to sit down. The key takeaway: these symptoms don't always appear together and they don't always look dramatic. Even one of them, especially if it's new and intense, deserves immediate attention. The earlier you connect the dots, the more time you'll have to act. Knowing the warning signals is only half the battle. In the heat of the moment, panic can wipe away everything you thought you knew. That's why preparation matters. Think of it like a fire drill. The more you rehearse the steps, the calmer and faster you'll respond when it truly counts. In a heart attack, seconds are precious. So now, let's walk through the 8 actions you need to take immediately if you're ever caught alone during an attack. Commit them to memory and practice them. The 8 survival steps. Step 1, stop what you're doing and sit down. If you feel the warning signs, don't try to push through it. Sit immediately in a safe, upright position. This reduces strain on your heart and prevents you from collapsing if you lose consciousness. Step 2, chew 1 regular aspirin if you're not allergic. Medical guidelines confirm that chewing, i.e. not swallowing whole, a 325 milligram aspirin tablet can help slow blood clot formation and keep blood flowing. Keep 1 in a small container by your bed, in your wallet, or in your kitchen. Do not take it if your doctor has told you to avoid aspirin, if you have severe stomach ulcers, or if you're allergic. Step 3, call emergency services immediately. Don't second guess, don't delay. In many countries, it's 911, in others, 115 or 112. Put the number on speed dial in your phone and on paper near your landline. The operator can guide you step by step until paramedics arrive. Step 4, unlock and open your door. If you collapse, rescuers may not be able to reach you in time. Prop your front door open or unlock it so help can enter quickly without wasting minutes breaking in. Step 5, position your body at a 45-degree angle. Lean back with your upper body supported on a chair, sofa, or against pillows if you're in bed. This eases the heart's workload and helps keep airways clear. Avoid lying completely flat, which can make breathing harder, and avoid standing or walking, which stresses the heart. Step 6. Notify someone you trust. Send a quick pre-written text or use voice command, "I may be having a heart attack. Ambulance is on the way. Please come." Even if emergency services are already alerted, having a family member or neighbor on their way provides extra safety. Step 7. Control your breathing. Slow, steady breathing helps calm panic and maintain oxygen flow. Try this simple rhythm. Inhale gently through the nose for 3 seconds. Exhale slowly through the mouth for 4 seconds. It's not about fancy techniques. It's about staying calm and preventing your body from spiraling into shock. Step 8. Stay as still as possible until help arrives. Your heart is already under strain. Moving around, pacing, climbing stairs, or searching for items only makes things worse. Stay seated, breathe steadily, and conserve energy. What not to do. You may have seen videos or articles online suggesting that coughing repeatedly, so-called cough CPR, can save your life. The American Heart Association has made it clear this is not recommended outside of a hospital setting. It can waste valuable time or give a false sense of security. Your focus should always be on aspirin, calling emergency services, and staying calm. Quick memory aid. A simple way to remember these steps is the acronym SACPNBCS. Sit aspirin, call prop, door 90 degree, half recline. Buddy notify, calm breathing, stay still. Write it down, practice it, and you'll never be caught completely off guard. A few months after learning these steps, one of my patients, Mr. Daniel Rivera, put them into action. He recognized the pressure in his chest, chewed aspirin, dialed emergency services, and propped his door open before lying back. Paramedics reached him in time, and the cardiologist later told him that those calm, immediate decisions kept his heart damage minimal. It's proof that preparation turns fear into survival. And you can do the same. The 3 prevention habits. Of course, the best way to survive a heart attack is to prevent it from happening in the first place. And while genetics and age play a role, research shows that daily habits can dramatically lower your risk. Here are 3 golden ones. Habit number 1, move for at least 30 minutes a day. This doesn't have to mean running marathons. A brisk walk in the park, dancing in your living room, or cycling with friends all count. Studies show that even moderate activity improves circulation, strengthens the heart muscle, and lowers blood pressure. If you can't manage 30 minutes at once, break it into 3 10-minute sessions. Habit number 2, cut the salt, add more plants. High sodium intake is one of the most common drivers of high blood pressure worldwide. Swapping salty processed foods for fresh fruits, vegetables, and whole grains helps your arteries stay flexible. A simple rule: if it comes in a package with a long ingredient list, chances are it's loaded with hidden sodium. Preparing meals at home lets you stay in control. Habit number 3, ditch tobacco and limit alcohol. Every cigarette damages blood vessels and reduces oxygen delivery to your heart. Quitting at any age reduces risk quickly. Within a year, your heart attack risk already drops significantly. And while some people think a daily glass of wine is protective, more recent studies show that heavy or even regular drinking raises blood pressure and weakens the heart over time. Moderation truly matters. The point isn't perfection, it's progress. Starting today, choose one habit to improve, then build from there. Small, consistent changes can add years to your life and make any future heart event far less likely. Recap checklist. Let's lock this into memory with a quick review. 5 warning signals: chest pressure, spreading pain, shortness of breath, nausea or cold sweats, and unusual fatigue. 8 survival steps: Sit down, chew aspirin, call emergency services, unlock the door, recline at 45 degrees, notify someone, control your breathing, and stay still. 3 prevention habits. Move at least 30 minutes a day, reduce salt, and eat more whole foods, and cut tobacco while limiting alcohol. Write these down, print the checklist linked below, and put it on your fridge. That way, if the moment ever comes, you won't need to remember from scratch. The answers will already be in front of you. Now it's time to make this real for yourself. Don't just watch. Take 1 minute today to prepare. Write down the 8 survival steps on a sticky note, or download the printable checklist I've linked below and put it where you'll see it every day. Your fridge, your desk, or even your phone's lock screen. Then make a personal pledge. In the comments, type the words, "I am prepared." It may sound small, but psychology research shows that publicly committing to an action makes you far more likely to follow through. By writing it, you're telling yourself and others that you're ready if the worst ever happens. And finally, help protect the people you care about. Share this video with your parents, siblings, or friends over 40. Knowledge like this only saves lives when it spreads. If you found value here, subscribe and turn on notifications so you don't miss future guides on protecting your heart and health. Preparation is power. You now know the signals, the steps, and the habits. The next time life tests you or someone you love, you'll be ready. And that readiness might be the very thing that saves a life.